it's really actually not unusual to have mental health issues present in kind of child adolescence. So half of all mental illness actually starts before age 14. And then when you zoom in on anxiety, we find that pediatric anxiety is the most common childhood psychiatric disorder. If you have a moody kid who's pre-puberty, they're more likely anxious than they are depressed even.
This is Sick Health with Kevin Ban, MD. Our show helps you navigate our confusing healthcare system so you can take control of your own health. I'm Kevin Ban, an emergency physician with over 25 years of clinical experience. Most recently, I was the chief medical officer at Walgreens, where I led the national pandemic response. Today, I had the great opportunity to sit down and talk to Mona Potter. Mona is a pediatric psychiatrist. She trained here in Boston at Mass General Hospital and Harvard Medical School, and she's worked at McLean Hospital for over 20 years. And she's focused on adolescent anxiety. And now she's working on a venture to spread that nationally so kids outside of Boston can get the appropriate care. We had a great conversation about adolescent anxiety. We talk about diagnosis, we talk about treatment, we even get into the impact of social media. Before we get into that conversation, here's a word from our sponsor. Today's episode is brought to you by C2 Sense. C2 Sense is working hard to bring lab-quality diagnostic equipment into the home and priced for everyone. Learn more at haloreader.com. Mona Potter, thank you so much for joining me today. I have really been looking forward to talking to you about adolescent anxiety. But that's not where I'm going to start. I actually want to start with you. I'm always curious about the physician journey. There are people who have known this is the thing their entire life. There are other people who kind of finally got there. That's me. Where did you start?
I always knew I was going to be a doctor. I actually have a very vivid memory of my kindergarten graduation. And when we had to get up there and say what we wanted to be when we grow up, I very proudly said, I want to be a doctor. Another one of my classmates had a different idea. He found it important to come and let me know that I'm a girl and therefore I couldn't be a doctor, which only made me want it more.
Oh my God, that's terrible. But I'm so glad you became a doctor.
Yeah.
And do you still know that person out of curiosity?
No idea who that kid is. And I'm sure it's a flippant comment on his part that I still remember today, which is kind of funny, but it's fine.
Well, in your rearview mirror, the next piece of it is, okay, so since you're 5 years old, that's crazy. I don't even know how that's possible, but it's inspiring. It's always curious, at least interesting to me, about how people land on their specialty. Yeah. So many people start off and they're like, you know what? I'm going to do pediatrics, and they become colorectal surgeons. There are people who want to be surgeons and they become psychiatrists. So where how about that journey? How did you actually land in psychiatry and then even adolescent anxiety?
Yeah. So I always knew I wanted to work with kids. So it was doctor and kids. So I went into medical school and actually founded the pediatric interest group. So was going to be a pediatrician of some sort. And actually psychiatry was the last thing on my radar. I left it as the last rotation of all of our clinical rotations in our third year. And then I got to our psychiatry rotation. It was on this addiction unit. And I was blown away by just seeing how high impact that relationship between brain and behavior is, and how the environmental pieces matter, and just how much we still have to learn about all of this. So I got intrigued and then had to frantically change around all of my rotations to kind of better understand if this is actually something I would want to do for my career. And just really fell in love with, again, just the way that brain and behaviors interact with kind of that genetic piece and the environmental piece.
And then just take me into adolescent anxiety. How did you get there?
My first job right out of fellowship was on an adolescent dual diagnosis unit, meaning we were working with teens who had co-occurring substance use disorders, addictions, and mental health issues like anxiety, depression. Loved that unit so much. These were kids who were coming to us. They were labeled as delinquents. They were labeled as like lost souls who are just had no interest in life. And when they came to us, what we realized is that their substance use was really in response to just a hard time managing those underlying emotions, that anxiety, that depression that would come up. What happened is I was working with these teens is that we would provide them this treatment on this residential unit and then try to send them to treatment afterwards. And we couldn't find treatment that was specific enough to the anxiety that they were experiencing. This is something we need to understand better, we need to pay attention to and deliberately treat. So we got the privilege, actually, of getting to create a program that we thought was going to help address anxiety and OCD in a way that really targets what these kids need in order to get on top of those emotions and really live their life to their fullest.
And now you're trying to take it just from Boston and you're pushing it to other places, which I love. So thank you for doing that. Okay,
thanks.
I'm going to take inspiration from that poster that I see over your shoulder. And I think a really good place for us to start is the brain.
This poster was given to me by a trainee because I just get so hyped up about the brain. I will still remember this teenage boy I was working with in our clinic, and I'm going on and on about the brain, and I paused and I was like, is this even interesting to you? And he looks at me and he's like, let's put it this way. Not really, but the way you're talking about it and your interest is making me listen to you. And I was like, okay, noted.
I 100% understand that feeling.
Yeah.
All right, take me through the brain.
Okay, so why I love being a child and adolescent psychiatrist is that the teen brain is incredibly malleable. So what we do and how we intervene and how we support that brain development can make such a difference. It can just make a lasting impact on this kid's life. It's a time of both opportunity and vulnerability because there's so much development happening. So if I focus on, let's say, 3 main points. So one is that there's kind of a back to front development. So the last part of the brain to come online is that prefrontal cortex. It's that part that's right behind our forehead. And it's the decision making, the executive functioning, the organizing, planning part of our brain. It's kind of what makes humans different from all other animals. And it really helps us in that kind of problem solving, rational thinking. Simultaneously, in that teen brain, that especially around puberty, the emotion center, that limbic center, is really on fire. That is the part that is, the world is being filtered through that part of a brain. And so that's wonderful in terms of making social connections and feeling passion. And simultaneously, it can also lead to some very impulsive decision making or decisions that are based more on how it feels rather than what that prefrontal cortex might tell us what is wise to do. So really important to kind of think about how those different regions of the brains are online, let's say in those adolescent years. What we also know is that it's not just about the regions, but it's also about the connections and how the different parts of our brain connect with each other. And in the teen years, there's a ton of pruning and myelination happening.
What is that?
Yeah, so you've got all these connections between the different parts of the brain, and so how the brain kind of talks to itself and then coordinates itself to make things happen. So we get so many impulses, so much information at any given moment that it would be inefficient to take all of that information in all the time and process it and then decide what you're going to do. So the brain needs to become more efficient. So in pruning, what the brain is doing is it's saying, okay, here you're clearly using this connection a lot. I'll leave that one. I'll strengthen that one. Oh, I'm not seeing you using this other connection all that much. I'm going to prune it out because that is going to allow you to put more energy into this thing that I see as important. I'm coding in as important based on what you're doing. So again, it's a lot of the experience that helps shape how the brain starts to really lay its foundation.
The brain is focusing on this sort of one pathway, that synaptic connection, but it's trying to really focus on building that pipe is the way I think of it. How does multitasking for kids impact that, if at all? I
mean, it's a great question. And I think we're still learning. I was just having a conversation with one of my MGH mentors that I reconnected with. And he's done a lot of research on this. And he's very clear. Digital multitasking in particular, everybody, we're all doing it, and many of us think we're really good at it, especially our digital natives. And what we're finding is that it really taxes the brain, because what you have is this developing brain, especially in teen years, developing brain that is already working really hard to bring on that frontal lobe to kind of make a more rational assessment of what's happening. And then you bring in multiple things, and now that same part of the brain is now having to divide its attention and make sense and code and process. So we might think that we're more productive because we're actually working quite hard, but in reality, that split attention is really taxing the system and actually making us less productive.
And that's my take, 100%. Like, I'm an emergency physician, and you know that about us. Like, we're constantly juggling and dealing with a bunch of things, some of them super critical, some of them much less so. But I have found now, and I don't know if this is a part of aging or just self-awareness, that I am not good at multitasking. In fact, I say that to people, like, I'm not good at this. My kids are profoundly aware of the fact that I'm not good at it, but I try to focus and I try to like get one thing done. And what you're saying is there's actually neurophysiology that supports the way I'm feeling, and it's not just old age.
Unfortunately, we're getting more and more evidence of it, which I will say I'm the worst culprit of saying I'm a wonderful multitasker. I love multitasking. I've always, even if you look at my medical school notes, there are doodles all over, and I have two screens, and I'm constantly trying to go back and forth between them. And it just makes me, again, feel more productive. It makes me feel like I'm using my time more effectively. When in reality, again, what we're seeing in the research is that that feeling doesn't actually translate to reality.
When does the pediatric or the adolescent brain fully mature?
You could consider it pretty fully baked, especially with that frontal lobe being kind of nicely connected by around 25. And we always joke that car rental companies that don't allow you to rent a car until you're 25 probably know brain development pretty well, or are using it without even realizing it.
My guess is that actuaries, it's one of the things I've learned. There's nothing by chance.
Yeah.
Actuaries know their thing, and they probably know brain physiology.
Yeah.
Adolescent anxiety, this is your thing. But let's get a sense for the scope of it. I feel, at least anecdotally, like I'm hearing a lot about it.
Yeah.
I happen to have a lot of friends who are dealing with this with their children. What's the scope of this problem?
It's really actually not unusual to have mental health issues present in kind of child adolescence. So half of all mental illness actually starts before age 14, and then 75% of it by age 25. So really thinking about mental health in kids and teens is an important thing for us to do. And then when you zoom in on anxiety, we find that pediatric anxiety is the most common childhood psychiatric disorder. So even to the point that if you have a moody kid who's pre-puberty, they're more likely anxious than they are depressed even. It really is pretty striking how common anxiety is even within that psychiatric realm.
All right. So the scope of this is really large. And one of the questions I wondered about was, how much is this is attention to the issue? You know, I feel like when I was younger, we just didn't pay attention to these types of things. We didn't know how to talk about them. We didn't know how to think about them, label them. Feels like we do now.
Yeah.
What is your take between what is awareness versus what is actually the rise of organic disease?
I mean, my take is that both have been the case, that we are definitely paying more attention and there's been an increase. What's been really nice to see is that pediatric offices, schools, they're screening more. And I think they're screening more because they're recognizing, they're seeing more of the sequela of not paying attention to it. And also parents, I'm finding, are talking a whole lot more. I mean, just even kind of anecdotally for me as a mom and a clinician, I would always get some people calling me, asking me for advice or kind of to talk through a friend's kid or their own child. It is through the roof now. And even when I'm in mom groups, moms are more willing to talk about what their kids are going through. So I think there's more of a general awareness and a willingness to really want to think deliberately about what might be going on with their child.
And it feels like an openness.
Yeah.
You know, what was previously something that you kept under wraps. I don't want to call it shameful, but somehow the word shameful came to my mind, is different. And people are like, no. You know, my mom's always been there. And by the way, Mona, you'll learn I talk way too much about my mom in the show. But she's one of those people who has her sayings. And she would say, well, if you had a broken arm, you'd go to the doctor, wouldn't you? So if you have a problem, sorry, Mom, that was a terrible, terrible sort of imitation. But it's true, you know, and so these people are in need of assistance and they're in need of help, and that's what you're providing.
I want to normalize anxiety too. I want to say that it is an absolute normal emotion to experience. All of us experience, well, most of us experience it. I'd say maybe all. And it can even be productive and protective at times. I always joke that if I didn't have anxiety through med school, I wouldn't have done nearly as well because it motivated me. My fear of failing or not doing right by my patients motivated me to stay in and study rather than always going out or vegging on the couch or whatever else would kind of feel easy in the moment to do.
So you're validating something that I actually said in the very first episode we did. We talked about the 6 pillars of health, and I talked about stress mitigation and behavioral health. And I talked about the concept, and you'll get this immediately, of eustress versus distress. Because if you say like normal stress or stress and distress, it just all feels super stressful. But if you say eustress, and that's exactly what you just described. So I feel really good, which is there's a certain amount of stress that helps us get stuff done.
Absolutely.
And then there's a certain amount of stress that gets to the other side.
And that's what it is. When the anxiety shows up in ways that starts interfering with decision making or interfering with functioning, or even causes everybody around to start feeling more distressed because everyone's just trying to manage and accommodate that anxiety, that's where it's no longer useful. It's no longer helpful. And it is really important to start paying more deliberate attention to how it's showing up and how we're all responding to it.
How subtle is this? So I'm a parent. Actually, you know this. I have a 17-year-old daughter, and then I have a 19-year-old son. I know you have 2 young children as well. So how does it show up? Like, at what point do you say this is no longer eustress? This is no longer what I would expect as normal behavior. When do you say, okay, something's up, I need to talk to my pediatrician or someone who has more expertise?
It would be great if there were like this clear line, but I think the important thing for us to know is that there's not a clear line, and it's more about paying attention to how emotions are showing up and how we're making decisions in context of those emotions. And what I'd say is that if you're worried, if it crosses your mind, talk to somebody. Because interventions don't have to be all or none. You could do little things.
What are the signs, the symptoms that people ought to be paying attention to, and then start thinking about getting care?
Yeah, I mean, when I think about anxiety symptoms, I think about it in kind of 3 categories: thoughts, feelings, and behaviors. We think about thoughts as what kind of thought process is happening for a kid. The anxious brain is just more likely to interpret situations as higher danger or more problematic. We call it like cognitive distortions or thinking errors. So, for example, I'm in heavy soccer mode because I coach my daughter's soccer team. So we're going to go with some examples here. So, for example, there might be all or none thinking. So either I'm the best soccer player on my team or I'm completely worthless and no good for my team and I might as well quit. There might be catastrophizing, like, okay, if I miss a goal in a game, I'm never going to be able to make another goal in another game, and then the team's going to hate me, and they're going to never want me to play with them again, and then I can never play soccer again. Or it might be like filtering out all the positives and focusing on the negatives, where it's like, oh, in the last game, yeah, fine, I made a goal or I scored a goal and I made an assist. But did you see how I missed those 3 shots on goal? And my goodness, I'm a terrible shooter and I can't score to save my life. So, and you can see how that anxious brain is just going to make it interpretations.
Okay, so you said thoughts, and then the second piece was feelings.
Physical feelings. I will say that I have so much respect for how anxiety shows up in the body. We see it where it can show up in headaches and stomach aches and just kind of general fatigue, even in like immune system function. I mean, our body is just so interconnected. So oftentimes, especially in the younger kids who don't have quite the verbal language to share, they might show up more with their bodies. They might show up in the nurse's office, or they might say, I don't feel so good, so I don't feel like I can go to school today, or I'm going to skip soccer practice, even though you know how much they love soccer practice. My daughter actually gave me permission to talk about her humble parent experience. So my daughter is this like feisty, like awesome, energetic, sporty kid who she pitches for a boys' baseball team as a 5th grader, right? So
she's a gritty kid.
She's a kid who will put herself out there and really is willing to try a lot. So I'm like, okay, she's not a kid I'm worried about with anxiety. All of a sudden she started having stomach aches. And I was like, this is strange. We got a call from the nurse. It's like, hey, she threw up. Can you bring her home? And I was like, Okay. So then we, with her pediatrician, go down this whole path of, is it a gluten sensitivity? We took out gluten, we took out dairy, we did a celiac test, we did all of this evaluation, and everything was coming back fine. And I was like, let me just try this out. So I talked to her about the mind gut connection, and I was like, sometimes worry shows up in your stomach in different ways. And she's like, yeah, I do notice that before a game. Like sometimes I'm a little worried about how I'm going to do. And I was like, I didn't know that. And what's fascinating is that after we had that conversation, she started identifying using words of how she was feeling a little worried. And then she would get in there and she was noticing it more. And she's not complained of a stomach ache in a long time. So that was like ridiculously humbling for me.
A couple of thoughts there that you make me think of. Number one is how powerful it can be when you identify a problem verbally.
Yeah,
right. So like
absolutely.
she put a name on it, she tagged it with a title, and it almost makes it go away to a certain extent. So that's the first piece. And the second piece is obviously, did you just say that the expert in pediatric and adolescent anxiety herself didn't make the diagnosis early on?
Really,
And I
Kevin,
think
are you really going to emphasize that? Thanks.
I love that. But folks,
know.
this is like 100% real life,
Yeah, it
which is if you
is.
think that we have some sort of inside track on getting it right, you're wrong.
Yeah.
Most of the stuff that I've learned is because I got it wrong.
Yeah,
Okay,
absolutely.
you talked about the thoughts, you talked about the feelings. Bring us home now with the third category.
And the third category, behavior. So how it shows up. So, we kind of look at it as fight, flight, freeze, kind of these like natural instincts to stress. The flight and the freeze are a little bit more obvious, right? The flight is the kind of avoidance, just basically saying, nope, I don't want to experience that discomfort, or I don't want to be worried anymore. So you just don't do it. And the freeze is I'm overwhelmed by it and I'm just paralyzed and I'm shutting down, or I'm inflexible. It can come out as the family wants to go out for dinner and the kid's like, nope, I'm not leaving. And really what's underlying it seems inflexible, but what's underlying it is a lot of worry about all the things that are going to happen if they go out to dinner. But I would say that the one that I find sometimes trips people up is the fight. That anxiety can make you really mad. It can make you really irritable. It can bring an energy that people will not interpret as anxiety and misinterpret as you're just a mean person. And I'll say this goes for kids and parents. Like we've had parents come to us in just such a fight stage because they're so worried about their child. That feeling of just so much worry about your kid that it brings this energy and this fight to try to get people to help you or figure out the answer. That can be overwhelming. That can not only be hard for the parent, but then it trickles down to the kid as well. Our behaviors as parents really matter for the kids also.
That's something that that you're making me think of. I talked to my older sister about this, Kate, and a lot of times when you see people who are aggressive, who seem very assertive, anxious, it's really fear that's underpinning that.
Yeah.
And sometimes what you have to do is sort of help them understand that that's exactly what's going on.
Yeah, I think what's hard is that when somebody presents with that fight mode, what it causes other people to respond with fight, when really what that person needs is reassurance and warmth and understanding. And so that's when that's really hard, because what the anxiety triggers as a behavior is actually potentially going to cause loneliness and cause people to distance themselves, when what you really need is a community to come around and help you feel like we're in it together. We've got this. We're going to get to the bottom of this.
Thank you for taking me through here, like how this shows up. And again, it's sort of, the feelings, the thoughts, and the behaviors, I think, is the way you put it together. And before I get into treatment, you made me think of something, which is the concept of nurture versus nature. So I'm going to sort of pause, and I want to deep dive into nature versus nurture. I have a lot of conversations with people around this. I have some pretty strong opinions. What's your take on anxiety specifically as it pertains to nature versus nurture?
I have zero doubt that it's both. I mean, absolutely. And this is where the twin studies help us understand the genetic piece. And so what we do see in anxiety-related twin studies is that identical twins are more likely to both have anxiety disorders. compared to fraternal twins who, but then when you look at fraternal twins who grew up in the same household or have similar environments, they are more likely than you would expect to also both have anxiety. So that really makes the case that both our genetics, our nature matters, as well as our environment and how we interact and how that environment interacts with us.
That makes me think is like, oftentimes people think that they're bringing it, right? There's almost like this feeling of guilt that maybe they're responsible for their kids' anxieties. And what I think you're saying is, no, actually, there's a very strong genetic component to this.
Yeah.
There's also a environment that matters, and so you can modify that. But
Absolutely.
there's no blame here, because sometimes, folks,
No.
we're just kind of born the way we're born.
Yeah. Well, and what I'll often say to parents is they'll come in and I'll say, especially when parents have multiple kids, it's like what works really well for one child might not work so well for another child. You can have two kids in the same house who respond very differently to the same parenting. And that's really what they bring to the table with their own kind of biology. And that is really important for us to remember. Because again, as parents, we can do the best we can. But so if we think about that anxious brain, what is really cool is that the rodent brain and the human brain have pretty overlapping fear circuitries. The fear circuitry is that kind of connection that really that drives our response to stress-inducing, worry-inducing, anxiety-inducing situations. And the fear circuitry includes the amygdala in the limbic system, so the prefrontal cortex and the hippocampus.
I'm glad you introduced those three areas. We've got the amygdala, and I want you to correct me here if I've got this wrong, but I love talking about this stuff. So you've got the amygdala, which really mediates the anxiety, the fear, the flight type of response, right? Which was probably useful at some point when a bush rattled and there could have been a tiger, but now mostly just gets in our way. So that's the amygdala. And then you have the prefrontal cortex, which is really where creativity happens and where there's much more logical thinking. And that can sort of override the amygdala if you favor that. And then there's the hippocampus. And I want you to sort of take me there. Like, what is the relationship with the three of these?
In the anxious brain, that amygdala is just way more likely to sound the alarm bell. What we see when we put an anxious brain in a scan or in a functional MRI, we see that amygdala is going to light up in response to neutral stimuli even. And so it's just more likely to alarm and say, oh, there's danger. And then, so it's hypervigilant, we'll say.
So in a kid with adolescent anxiety, they have a very hypervigilant amygdala.
Yeah, exactly. And then that prefrontal cortex, which is supposed to be our kind of, let me assess and let me make sense of this. And really, do you need to be so worried? It's already still coming online in adolescence. And then you take the anxious prefrontal cortex, and it has what we call an attention bias to threat. It is more likely to interpret a situation as threatening and scary. And so it's not necessarily going to go to the amygdala and say, hey, it's okay. Don't worry about it. We can rest a little bit.
Okay, so you've got the amygdala, which is fired up, and you've got the prefrontal cortex because it's number one, not developed. And then number two, it's not really quieting the amygdala in the way it should. So you're set up now, your brain is set up for being anxious.
And then you've got the hippocampus that's coding all the memories. And it's kind of looking and seeing what's happening here. And it's like, ooh, scary situation. Let me put that in so that next time I know that I don't have to even think. I just know that this is not a good situation for me to be in. You can see again how back in the caveman days, you got a lion chasing after you. That's a great system. Today, where our stressors are just not dangerous in the same way, it can be really exhausting. So let's say you've got, I don't know, I'll call her Anna. So Anna walks into her third period class, and she sees a group of girls sitting in the classroom, and they're laughing and talking and just lots of chit chat. And immediately Anna, who has an anxious brain, is like, oh my goodness. They're laughing at me, my outfit, or what I said in last period. They thought that was the dumbest thing, and they're definitely laughing at me. Whereas somebody with a non-anxious brain might say, "Oh, they must be having a good time," or "Oh, like they're laughing about some random other thing," or even if it's "Oh, wait, what is wrong with my outfit? okay, maybe I'll go check it out and see what's happening. For Anna, it's, oh my goodness, like this is awful. And what she will then do is go and hide and avoid and shut down. And what's coded for her is that she's not good enough, that people are judging her. And that's going to cause her to avoid more social situations, which is only going to reinforce this message that her prefrontal cortex is given to her.
That was really helpful, actually, because I think a lot of people are going to connect with exactly that type of scenario. Okay, so we've talked about what it looks like. What do we do about it? What are the treatments? A lot of times I like to say, how do you think about medication versus non-medication therapies? So take me there.
Yeah. So the good news is that, and why I really love treating anxiety is that it is so treatable when you use the right intervention. And what I sometimes see is that we can talk about it, but ultimately you got to do some talking. You also just got to do some doing. So the gold standard for anxiety treatment that's kind of proven in our research is CBT, cognitive behavioral therapy. From a therapy perspective, and then medications can also be incredibly useful. When I started as a child psychiatrist, I was like, I don't want to medicate the pediatric brain. And I was incredibly conservative. I will say that what I have seen clinically and in the research is that not addressing anxiety is also a problem. And so having a kid grow up and engage with that environment through that high anxiety also shapes the brain in potentially unproductive ways. So it's really thinking about how much are you losing by not intervening.
I totally get this. And in fact, it's interesting because one of the things that I talked about in an earlier episode was how we think about, and I'm just doing this by way of analogy, how we think about obesity. And the truth is, I said, I don't think we truly treat it like a chronic medical disease. Any chronic medical disease, we usually start with medication to sort of intervene in the acute phase, and then we want to do modifications to behavior and try to get the person off medication. And that's what I'm hearing from you, which is you're okay with we don't want to medicate these kids. We don't want them walking around, completely withdrawn. This happened to my nephew when he was young. He was being treated for ADHD, and it just removed him. And my sister was like, "Hey, time out. We need to approach this differently." But what I think is useful is the combination.
What we talk about as on our psychiatry team is when we think about the role of medication, we think about medication as helping turn down the intensity of how the anxiety shows up, how that biological vulnerability shows up, so that the child can actually engage in the therapy and use the interventions and respond to the anxiety in a different way. So it really is, the medication unlocks the ability to really shift behaviors in response to the emotions. And our research actually shows that CBT can be very effective. Medication alone can also be very effective. The combination is more effective than either one of them alone. And all of them are more effective than placebo. So we've got some good randomized controlled trials that show us that these interventions do work.
Let's go deeper into CBT, into cognitive behavioral therapy. What exactly does that look like? Can you give me some examples?
Yeah, CBT is goal-oriented, change-oriented, directive therapy that really takes into account what we've been talking about, that connection between thoughts, feelings, and behaviors, and really addressing and having interventions on each of those points of the triangle. On the cognitive point, it's catch, check, change, or detective thinking. Let's pay attention to what thoughts are coming to our head and how we're assessing a situation. Let's catch the thought. Let's challenge it. So again, that all or none thinking. If I'm either just like the greatest soccer player on my team or I'm not worth it. Let's look at the evidence for it's being reasonable and worth it being on this team, even if you are not the best player on the team. And so then let's change how you're perceiving yourself on this team.
Got it. All right. So that's really helpful. Again, it's one of those things that I've said, like the moment you're able to identify and name a problem is the moment where you're really inside the four walls of cognitive behavioral therapy, and that's useful.
With cognitive behavioral therapy, one of the big misses that oftentimes happens when somebody is in cognitive behavioral therapy is that there is a lot of focus on the cognitive piece. So really talking about how the anxiety shows up and talking about the the responses, and less emphasis on the actual behavioral intervention piece. So that is where it's really important that both are happening and saying, okay, so now we understand how it shows up and how the thinking errors are showing up and how we're wanting to challenge those. We also want to think about what you're doing in response to that anxiety. So when it tells you to avoid, approach. When it tells you to be inflexible, try one step forward towards what you're being asked to do. When you're getting angry and worked up, notice and take a breath, take a pause, move back, really try to manage the big emotions that come up, and really lean into responding and behaving in a different way from what your anxiety tells you to behave. And what we find in the research is that the more somebody does that, the more they do it, practice it, the more effective the treatment is. It's like learning a new language. If you're going to learn French and you go to a class once a week and that's the only time you're really thinking about it, the only time you're talking, but then you go back to English the rest of the week, it's going to take a long time to learn that new language. Whereas if you go to the class, you learn some new words, and then you go and you practice them and you talk to your friends and like use those words, integrate them in your brain. Again, it's making this is where the brain's making those connections. It's saying, oh, these are important connections. These are new habits I want to make easier to bring up over and over. And so that really helps solidify that new learning.
So that's a practice makes perfect type of scenario, and really useful if you can learn these skills throughout the entirety of your life, right? So like this is a really good foundation.
I'm still working on this. I mean,
I think that's what I was thinking about is that, this is such a great foundation for these kids as they become adults, because these are always useful skills. Mona, you have been so generous with your time. I want to take us into the final stretch here because I know you have some things going on this afternoon. What do we get right about adolescent anxiety? Where are we crushing it?
Well, Kevin, you're having this conversation with me. I think where we're crushing it is that we're really starting to have more open conversations and being curious. One thing that is really wonderful is to see the shift and the openness to understanding how mental health really contributes to overall health and how important it is for us to have these conversations, to bring awareness, to really think collectively about how we can support our kids and teens as they go through their kind of the growth and development through their emotional maturity.
And that's what I come away with. I feel like, okay, there's a way to understand that a person is really struggling and needs intervention, but there are really good interventions that can help kids through it. So that's helpful.
Yeah. It's also been really great that there's just been a lot of intervention innovation. So it's also really encouraging to see the way in which, for example, we're thinking about how technology might play a role. I'm not saying that it's going to take over, but again, being curious about all the different pieces that might help us be even more effective.
You mentioned technology, and I think we're going to land there. We got to hit social media. But I asked you what we're getting right. I would be remiss if I didn't ask, what could we be doing better?
Yeah, I mean, I think it's access to treatment. Frankly, there is a shortage of experienced clinicians, especially who really have specialty in treating anxiety. And so really thinking about how we collectively as a community make sure that we are really understanding and thinking about how we approach and support our kids.
And that's my experience really across all of behavioral health, and not just adolescent anxiety, is that there's so much need, but we have a very hard time being able to meet that demand with enough practitioners. And I know people are trying to do virtual care and trying to leverage technology, but to a certain extent, like, we have a way to go. After the break, Mona and I are going to go deep into a study that was just recently published. And I think you may even find some of its findings surprising. But first, a word from our sponsor. C2 Sense is doing important work with its Halo platform, applying technological advances in chemistry, machine vision, and material science to provide both patients and providers with laboratory-level accuracy at low cost when they need it. The pandemic reinforced the importance of being able to test in the privacy of your own home. C2 Sense's goal is to use their patented technology to ensure the same quality of testing you would find in your doctor's office in the comfort of your own home. So if you're suffering from upper respiratory symptoms like cough, sore throat, nasal congestion, or a headache, keep your eyes out for C2 Sense as they're developing tests targeting upper respiratory conditions such as COVID and flu. If you want to learn more, see what they're up to at haloreader.com. Okay, social media.
Okay. Social media.
All right.
Ooh.
Now, I'm looking at the time and we probably can't go super deep here, but I don't think you can have a conversation about adolescent anxiety and not talk about social media. So take us through it. What are your thoughts about social media? Is it a thumbs up? Is it a thumbs down? Is it somewhere in between?
It's a thumbs side. How's that?
Fair.
It's so
and probably very balanced.
It's so nuanced, Kevin. And I mean, first of all, just even how you define social media is changing by the moment and also so diverse from kid to kid or group to group. So I think that it's hard to come up with a absolute it's terrible or absolute it's great, and you even see that reflected in the research where you can find evidence for and against it.
When we had a call leading up to this, you had mentioned a certain amount of excitement around a new study. I think that was published even within the last month. So take us through that.
One of my former colleagues, I was just published with some colleagues of his, what was a really intriguing study in which they used a big data approach to take a more nuanced view on how digital exposures relate to mental health. And so they talked a lot about how it's not just, are you using social media or not? And they also looked at the impact of non-social media screen use as well as non-digital adversity, just to see how those might play into the risk of mental health. So it was a really well done study. So they're really saying that social media use can encompass a lot of different ways of engaging. And so they're really trying to look at kind of different components of how kids are engaging in social media to get a little bit more specific on how that might relate to mental health. And so what they found were 4 specific ways of engaging with social media that had particularly detrimental impacts on teen mental health. So 4 things were weeknight video game screen time. So that having a social media account that is secret from your parent.
Okay.
And then, not surprisingly, addictive social media use and cyberbullying.
So I want to go through those again because I really want to be clear on these.
Yeah.
So number 1, gaming at night. Right.
Right.
So if a kid's playing video games at night, that's a concerning sign. If the kid is hiding, did you say, the use of social media from the parents?
Yeah.
I'm nodding my head because I think a lot of us have kind of been there. The third was addictive behaviors.
Yeah.
Okay. And then what was the last?
Cyberbullying. So experiencing cyberbullying in the social media realm.
I'm going to react to the first one.
Yeah.
And only because as soon as you said, gaming, and here's kind of like me getting gamed, but my son played a ton of Fortnite when he was younger. Oh, yeah. Interestingly, he kind of grew out of it. Huh. But what he wanted to do was play a lot of Fortnite, and he was playing with my younger brother's youngest daughter. Okay. They live down in New Jersey. I live up in the Boston area. Okay. And so he would game me by saying, "Yeah, but I'm playing with Tate." And the interesting thing about this is that when I would listen to them playing, mm-hmm. it was real play. They were laughing, they were, yelling, and they were working together, and it was like true play. And it kind of warmed my heart that he would be playing with my niece. What we had to do, so I liked that, quite honestly, but what we had to do is we had to put some guardrails around it.
Exactly.
And I used to, the way I said it to my kids is like, hey, play me, okay? Like, I want to see balance. I want to see you doing your homework. Mm-hmm. I want to see you gaming. I want to see you playing outside. Exactly. Every once in a while, like even if you're not reading the book, like sit in the corner and make it look like you're reading a book. But what we really pushed for was balance.
Exactly. So that's exactly the conversation we're having in our own home as well. There is a social aspect, and by not allowing them to play, we're depriving them of a certain social interaction as well. So I'm absolutely not condoning the like just take it all away. It's more about being deliberate and thoughtful, and that's where the third point of addictive social media, I think, is really salient. So what I ask my own kids, what I ask kids who come into our clinic, I said, let's pause for a moment and let's just think about your use. So first of all, when you're using social media, before, during, after, pay attention to how it makes you feel. And we've definitely had kids say, oh my goodness, yeah, I noticed that I just feel a whole lot worse after I've been going back and forth. Others will say, no, like I feel great. Like I got my little chat in, my connection in. So again, it's more of an awareness of the impact it has on you as an individual. And then it's say, okay, let's come up with a plan. Like, let's say that this is our social media plan, that you will engage in it in this way, and then track how able are you to stick to that plan? How angry do you get if you're not able to engage in your social media? How distressing does it feel to not be able to get, like, how much do you need it versus how much is it, yeah, this is good to have. And that distinction, I mean, again, these are the same questions we ask of other addictions, but it's really bringing that awareness to that need versus want and being mindful of that.
Yeah, I think that's really helpful, and it's interesting. What I think we really should do here, because I feel like we're just scratching the surface on social media and its impact on adolescent anxiety. I think it's real. I think all of us have to navigate through it, and simply by saying no, it's a thing that I kind of learned in general as an emergency physician, which is like just like being really black or white about, abstinence. No, it just doesn't work. And it doesn't work in parenting. So what I'd like to do before we wrap here is to make a commitment. And this is my way of kind of pulling you back and say, look, I'd love to have you come back. And maybe what we do is go deeper into this very topic, where we do just a session, an episode on social media, if you're game.
Sure. That sounds like fun. We can figure it all out together.
I love that. It's the only way I know how to do things.
Yeah.
Hey, look, I've got this way of ending, every show, and it's called Sharing Beauty, okay? And the idea here is that when my kids were younger, if you saw something beautiful, we'd say, hey, shout it out. And it's kind of a way like, hey, there's a beautiful sunset, shout it out. It actually happened yesterday. We were having dinner, sun was setting, and my daughter shouted it out. It's really cool. So I know you brought something, but it requires a little bit of explanation. Yeah. So take us there.
I love this video, and we actually show it in our parent group in our treatment. And I showed it to my kids too, to help them understand some of my behaviors towards them as a parent. So this is a clip from the Ray Charles movie about the experience his mother had of believing that he was strong enough and capable enough of taking care of himself in what felt like a really tough moment where I get teary just thinking about it. All the mom wanted to do was go in there and help him and save him and help him feel better. But by doing so, she was depriving him and his brain the chance to see that he can do it. So this is a really, it's a moment of just, again, it brings up a lot of emotions, because as a parent, all you want to do is protect your kids and take care of them. But sometimes what's more protective and what's more caretaking is to actually step back and show them that you believe in them. And so that's what this clip is.
I love it. Wow, you really respected the true sense of sharing beauty. So thank you for doing that. And we'll make sure that Chev drops it into our show notes. Mona, thank you so much for your time. It's been a fascinating conversation, and I really enjoyed it. I want to thank Batsheva Gez for producing the show, and I want to thank all of you for joining. In fact, please give me some ideas for the topics you want me to cover. Do that at my YouTube channel under a video. Thanks again. Be well. This show's content represents my personal opinions. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and does not create a physician-patient relationship with me. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or your general health.